Okay. I appreciate the opportunity to be here this morning. As you can see from, I guess, my bio, I've been involved in women's health issues for the last 30 years. So I guess I have a pretty good perspective on a lot of the issues that were discussed. One of the questions that I was asked to respond to was how we make our decisions in terms of the issues that we focus on. And that, of course, can be in any number of ways. I mean, if there's a specific women's health issue that's in the news, or it's a month, whether it's Heart Month or Breast Cancer Month or whatever, we'll focus on some of those issues. But also we have a continuous website that talks about keeping women healthy generally and all the issues that women have to address, whether it's pregnancy, menopause, heart health, et cetera. So we have a very robust both social media as well as our own website. And of course, I and other members of the staff attend all the meetings on, the pharma meetings, the meetings on fibroids, endometriosis, what all the groups are having. And we learn from those groups and share with them and share our information with them and their information with us. We do work with other medical health specialties. We work with ACOG and the nurse practitioners, A1, and all the other groups, as I said, the disease groups as well. We do a lot on advocacy and policy, particularly now with insurance issues being so front and center, and a lot of the insurance policies that are very detrimental for women, or can be very detrimental for women in terms of formularies and medications of maternal health, et cetera. So we're very involved in policy and then advocacy to make sure that there are treatments available and that insurance coverage is available for women as they should be. In terms of, and so we do a lot of outreach, a lot of education, and we work with a lot of other groups to do so. This is an interesting issue. I was very involved in the Women's Health Initiative. I testified shortly after it came out. I think we've gone through already some of the issues, and I think both the fact that, well, I think most recently, most people feel that timing was sort of one of the major issues, and that if you started early, that there were a lot of helpful benefits, but if you started in late menopause or post-menopause, that's when some of the trouble began. Also, as was discussed, there are other medications, patches and creams and other opportunities for women to use. I personally, had a lot of problem with the WHI, and when I was at the Society, we had a roundtable of all the major researchers on the study. And there was, I would say, major discrepancy. For the most part, people questioned the results. And then there were a couple of people that obviously supported it. Most recently, and several books that I've read on this. Most recently, I don't know if you're aware of Avram Bunning, who wrote a very good book going over all the research and all the issues, cardiovascular, colon cancer, Alzheimer's, et cetera. Sort of coming to the conclusion that really timing was the issue. And I won't go into the WHI, but I mean, I'm sure most of you are aware that the question was cardiovascular disease in older women, and it ended up being a lot of other things. So anyway, I think because of the way the news was covered, I know that women would stop automatically on their hormones. Doctors were afraid to prescribe it because of liability issues. And there was, real panic in terms of the use of them. And at that time, and as was discussed earlier, I think a lot of women who still needed at least something for hot flashes or vaginal atrophy or something would turn to these, what they thought were natural alternatives. And as, of course, has been said, I don't have to reiterate all the issues that go along with that. in terms of the unregulation and not knowing what the efficacy and safety is. What I can tell you, though, is we've recently developed a partnership with WebMD, and our first program is going to be about menopause. And I'm hoping, and we now have 70,000 monthly visitors, but WebMD has 70 million. Now, they're not all women, and they're not all looking for menopause information, but it's a pretty significant audience. And so what I'd like to do, and as I said, I've been aware of this for a while, is like to start educating women on the latest research and also the issues about bioidenticals. So I know the people from the FDA are aware of this, and I have a copy if anybody wants to see it, but a number of us, NAMS, ACOG, Healthy Women, nurse practitioners, wrote a letter in February to the FDA listing all the issues that were actually currently covered, along with the citations and footnotes to, to further research. And that letter went to Scott Gottlieb, and I'm assuming that those people from the FDA are aware of the letter. I have a copy with me if you want it. Thank you.
That'd be great. We'd love to, please do leave us with a copy of that. That would be wonderful. We appreciate it.